Good morning. We will now call a special meeting of the Waco City Council on June 23rd, 2020 to order at 11:31 a.m. Joining me online today are Mayor Pro Tem Andrea Bearfield, Councilmember Hector Sabito, Councilmember John Kennard, Councilmember Dylan Holmes, and Councilmember Jim Holmes. Councilmember Dylan Meek and Councilmember Jim Holmes, sorry. On March 16, 2020, the governor suspended various provisions of the Open Meetings Act pursuant to his state of disaster authority. The change was effective March 16, 2020 until further notice or until the state disaster declaration expires. In accordance with distancing guidelines and while providing as much transparency as possible, this Waco City Council meeting will not be open to the public. This meeting is being broadcast live at wccc.tv. The audio is also being recorded, and video and audio recordings will be available to the public. According to the governor and attorney general, statutes that may require face-to-face interaction between members of the public and public officials are suspended, provided, however, that the governmental body offers alternative methods of communication with their public officials. This includes public comment on agenda items. In an effort to allow for as much public input as possible, those who wish to submit their written comments on a listed agenda item were asked to submit their comments to the city secretary office by 9 a.m. today. The city secretary will read into the record any comments submitted for items on the agenda at the appropriate time. Now please join us for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands,
one nation, under God, indivisible, with liberty and justice for all.
Thank you. Esmeralda, have we received any public comments on the agenda item?
Yes, Mayor and Council, we did receive some public comments, and I have Liz Caraway on the line, and she's going to read those from self-isolation in her office to avoid having too many people in one location. Liz, can you hear us?
Yes, can you hear me?
We can.
Yes.
Okay. Becky Burns, please vote for mandatory mask wearing in all businesses and public places. I'm a local pediatrician, and the rise in local COVID cases is very concerning. We could overrun our local hospitals with COVID patients with the exponential spread of this virus. Mask wearing is simple and has been proven effective in our country and others. Perhaps reminding the public that wearing a mask might help prevent a future economic shutdown and save lives will make it seem less obtrusive. Please vote for the masking rule. Next comment from Rebecca Mahan. Dear City Council, thank you so much for serving on City Council. As requested, I am sending you my opinion on the mayor's recent order for businesses to require face masks. My husband and I are family physicians in Waco serving with Family Health Center, and we fully support the mayor's order. We do encourage a time limit for the order to have to be renewed and reassessed regularly. This has been a challenging time for everyone, and I believe that many in our community are suffering from anxiety about COVID-19, and the only coping mechanism many have for it is denial. Perhaps this is why very few people are taking the situation as seriously as they should be. When out and about, very few patrons are wearing masks or standing 6 feet apart. Little leagues are still playing, camps are still going. It is as if some people have returned back to pre-COVID ways altogether. Already, my clinic has been pressed to the max this week, trying to take care of both the sick and the well. If COVID cases continue to climb as they have this week, I am concerned we will have to start denying care to well people in order to take care of the sick. There are only so many people we can see in a day. This will delay usual health care that people truly need. If my staff starts to fall ill or gets quarantined from a positive contact, our capacity will drop quickly. You can see how very easily this will become a crisis. This doesn't even include hospital needs. We are at a crucial point in time to prevent a huge surge that once we miss our window cannot be undone. In my opinion, mandatory masks are the minimum. I also think recreational activities such as movie theaters, little leagues, and indoor restaurant eating should also be shut down for a couple of weeks. Why is the city planning on hosting a Little League tournament? This has pushed little leagues around the county to continue playing during this pandemic. Their competitive nature will not allow them to sit out? Why are schools having football practice? These types of things are not worth the risk. I understand keeping businesses afloat for the sake of our economy and its owners, but recreational activities are different. Praying for you all and thankful for you. The next comment is Sally Weaver. I am a family medicine doctor, hospitalist, and mother of 3, wife of a Baylor professor, and a concerned county citizen. I am thrilled that our mayor is looking out for our community by issuing the mandatory mask order. As a frontline healthcare worker in a clinic and at both local hospitals, I know that the community at large wearing masks will help stem the concerning increase in COVID cases in coming weeks. As leaders in the community, the Waco mayor, as well as the Waco City Council, have an obligation to protect the public from themselves at times. This is one of those times. I pray the City Council would uphold Mayor Deaver's mask order. The next comment is from Debbie Usi. I know the city is discussing and will form opinion shortly on the call to wear masks in our community until the threat of spread of this virus decreases. I'm a healthcare professional, nurse practitioner, and I feel very strongly that this is an important step for our city management to take. There is so much misunderstanding with our public right now about the importance of masks and the proper way to wear them, despite the great information that is being provided to us all. I sense many people feel they are the exception for all the wrong reasons. My fear is that unless there are repercussions to businesses that do not insist on their patrons wearing a mask, it will likely not be followed. I believe if we can keep our exposure and positivity rate in control, we can make it through this crisis. Just like everyone in the healthcare field expected, our numbers rose and continue to rise with the reopening of our city, which was probably a bit too early. No one takes closing businesses lightly, and certainly no one wants this to happen. However, if we could convince more people that physical distancing and wearing a mask are important, we hopefully will not have to close anything again. Long and short, as a 40-year healthcare professional with most of my experience in the hospital setting, primarily in the critical care areas, I strongly feel the need for the city to make this very important mandate despite those who oppose it. Next comment is from Barbara Lee Sim. Please let Mayor Deaver know I am writing my congressman, both senators, the governor, and president regarding your oppressive face mask order. Thank you. The next comment is from Lexi Osterwind. So I saw you were holding a private meeting at 11:30 this morning about the mandatory face masks and what to do about coronavirus. I wish this meeting would be public because you would see how many of your citizens are against the mandatory face masks. There are more of us against it than you think there are. I just recently moved to Waco, end of April, and honestly, it angers me that you have enacted this, Mr. Mayor. What you don't understand is you work for us. You enacting this mandatory mask infringes on our rights. You are fear-mongering. You say a lot of people have recently been diagnosed with COVID, but did you look at if there were underlying issues? Are there active cases, or are there people with antibodies, which means they already had it? There are so many things you need to take into consideration. Have you actually looked at sources other than the CDC and the World Health Organization? Have you looked at the recovery rate? Which, by the way, if you did so, you would know it is a lot higher than the death rate. According to coronavirus.jhu.edu/US-map, there have only been 354 confirmed cases in McLennan County with 5 deaths. How many of those cases have recovered? Have you noticed that the CDC and World Health Organization keep flip-flopping on how bad COVID and the precautions you take are? If you make masks absolutely mandatory, Waco itself will lose a lot of business. I know a lot of people, such as myself, will shop outside of Waco. And because of that, do you have any idea how many mom and pop businesses will go out of business because they were already suffering from being closed down? You enacting this is not protecting us. You enacting this is going to cause a lot more damage than you want to think about. I ask that you please remove your mandate and not let fear control you, that you let our immune systems do their job. The next comment is from Jerome Biggings. To whom it may concern, my name is Jerome Biggings. I have lived in Waco for 2 years since relocating from California and love everything about this city. The beginning of March is when everybody's lives changed for the long run, when we were affected by a new disease that spread all over the world, which introduced a new concept called social distancing. The purpose of this comment is to provide my thoughts on how this now is that we're approaching July. I believe that, like other illnesses that you can catch in the air, such as the flu, common cold, mono, strep throat, etc., coronavirus is no different. I've listened to doctors and other medical professionals on both sides of the story and have concluded that because it has been proven that people can recover from this, except seniors and anyone that has a weak immune system, I believe that wearing masks everywhere we go and social distancing does more harm to us and gives people a higher chance of getting sick. I've been living on this earth for 44 years now, and I have had the flu, bronchitis, strep throat, chicken pox, and gotten many colds in my lifetime, but yet I'm still healthy as an ox. I also take full responsibility for my health by making sure that if I fall ill to anything that can spread to others, I stay in my house and focus on my recovery. Plus, I always wash my hands before I cook, eat, and other activities I participate in. My current profession is IT specialist, where I service computers, printers, phones, security cameras, and network equipment. I've helped set up offices, clear offices, and conference rooms. My point to this is that my hands are always busy working on something, and I always wash my hands after I complete my task. I believe if we continue to practice self-care and good hygiene, these methods will be more effective than wearing masks and social distancing. Our bodies are made to breathe in air and breathe out carbon dioxide. So not getting out the carbon dioxide can contribute to weakening the immune system, which will make people sick. Finally, I believe that forcing people to wear masks is a violation of our U.S. constitutional rights. The First Amendment gives us freedom of choice, and I believe that it should be optional and not a requirement. Thank you for taking the time to read my email. The next comment is from Larissa Fallon. Hello, I am commenting regarding the mandatory mask order for Waco. I believe every citizen has a right to decide if they want to wear a mask or not. Studies have shown that masks do not help the spread of the virus. It actually makes it worse. Not to mention it depletes the oxygen level of the person wearing it, which can be deadly. When breathing back in air that your lungs filtered, it is causing a greater risk of infection. I believe not only will businesses suffer due to mandatory masks, but more importantly, our citizens will suffer. I do believe our COVID numbers will peak. Not to mention our numbers are very low right now. There are 251,147 people in McLennan County, and 371 people have had COVID. That is only 0.15% of the population. To force someone to wear a mask is unlawful. There are people who have conditions that make it difficult for them to wear a mask. Masks create a false sense of security and create fear. A patron of a business should not be denied service due to not wearing a mask. The patron should also not have to show them a doctor's note or the ADA compliance paperwork. Also predict that with mandatory masks, we'll see a peak in people yelling at their fellow citizens, such as in the larger cities where masks have been mandatory for a while. There are countless videos and cases of people being yelled at or berated due to their choice of not wearing a mask. That is not the type of city we are, and we should not force one view on all. I appreciate the city doing their best to help the situation. However, this is not the way to go about it. I am currently pregnant with a 1-year-old, and I have gone about my normal business without a mask or social distancing since this began. I started taking medicine in order to help boost my immunity. I believe as adults, we should be able to decide what is best for ourselves and our families. And lastly, I have included a few statistics to my email. I would like to cover 3 things: N95 mask and masks with exhale ports, surgical mask, filter or cloth mask. N95 masks are designed for contaminated environments. That means when you exhale through N95, the design is that you are exhaling into contamination. The exhale from N95 masks are vented to breathe straight out without filtration. They don't filter the air on the way out. They don't need to. Conclusion, if you are in Stewart's and the guy with COVID has N95 mask, his COVID breath is unfiltered, being exhaled into Stewart's because it was designed for already contaminated environments. Surgical masks. These masks were designed and approved for sterile environments. The amount of particles and contaminants in the outside and indoor environments where people are clogged, these masks vary very quickly. The moisture from your breath combined with the clogged mask will render it useless. If you come in contact with COVID and your mask traps it, you become a walking virus dispenser. Every time
Liz,
you put your
Liz, I'm sorry. Let me stop you for just a minute. That's
Yes,
the end
sir.
of 3 minutes on this comment. I believe that's where we are supposed to stop these comments. Is that correct, Esmeralda?
Yes, sir.
Okay, so
Excellent. I'll move to the next
comment,
one.
please.
This is from Zha Chen. As an owner of 2 businesses in Waco, I commend the mayor and city council for taking the necessary steps to ensure that fellow businesses are requiring masks for not only employees, but also for the general public. I understand that it is hard on businesses to enforce this rule, and we will do the best we can to keep our team and guests safe. Thank you for taking the steps needed to enact this order. Many people online continue to be against the order because their desire for their personal choice and freedom. However, there are many countries around the world that have shown to lower their cases by the use of face covering and masks. One of them being the country my parents live in, Taiwan, which has gone 2 months now with 0 community spread cases. The use of masks early on in their COVID-19 pandemic interventions, along with the extensive contact tracing and limiting of international borders travel, was what helped them get to where they are at today. Taiwan never had shelter-in-place orders nor lockdowns, and they believe the use of masks and extensive contact tracing led them to be where they are. Let's continue following their lead. The next comment is from Amber Lastly. As a concerned citizen of Waco, I urge the city council, who is meeting today because of your deep concern for our fellow Wacoans, to consider the potential hazards of all citizens being required to wear facial coverings. There are many studies that cite the actual hazards associated with cloth coverings. On April 22nd, 2015, a cluster randomized trial of cloth masks compared with medical masks in healthcare workers was published in the British Medical Journal stating, moisture retention, reuse of cloth masks, and poor filtration may result in increased infection. Further research is needed to inform the widespread use of cloth masks globally. However, as a precautionary measure, cloth masks should not be recommended. This study also cites that you are 3 times more likely to contract influenza-like illnesses if a cloth mask is used versus no cloth at all. A more recent study involving 159 healthcare workers aged 21 to 35 found that 81% developed headaches from wearing a face mask, and all healthcare workers felt like the headaches affected their work performance. Headaches associated with personal protective equipment, a cross-sectional study among frontline healthcare workers during COVID-19. And as I am currently 30 weeks pregnant and have suffered breathing issues through the entirety of my pregnancy from high levels of progesterone that are not COVID related, I am including this study, pregnant women wearing N95 mask. The next comment is from Kathy Downey. We are not for mandatory mask requirements. It is not recommended for healthy adults to wear one. They should in no way be made mandatory when there is conflicting science. No one is responsible for my health besides myself. It is our right to be in public without a mask if we choose. First, contact tracing, then mandated mask wearing. What's next? Where does this end? So many of our rights are being violated. And churches are exempt? This makes no sense. If the 6 foot works, then why the masks? If the masks work, then why the 6 foot? If they both work, then why the lockdown? Remember when we were all told this 2 weeks ago? We are only prolonging the inevitable. This virus is not going away. And if you really believe masks work, then why are you worried about those not wearing them? Plus, the requirements for face coverings are not even adequate for the size of this virus. You can still catch this with a mask on. This also needs clarification on when doing so poses a greater mental or health risk. So what about ADA laws? Are we no longer allowed to shop local? The death rate is less than 1%. We need to get back to work. Those at risk or fearful are the ones that need to stay home. There have been more deaths in Texas on the roads this year than from COVID, but are we going to stop driving? The next comment is from Justin Wood. If masks work, why are there other restrictions? If masks don't work, why wear them? In addition, wearing a mask indoors while carrying Texas LTC CHL laws is illegal in my understanding. The following comments were received by phone call. The first one is from Deborah Illenfeld. She called to say thank you to Mayor Deaver for the mask order. She is high risk and appreciates the efforts by Mayor and Council. The next phone call is Laurie Pierce, a small business owner, and is upset with the mask order. The next phone call, Stan and Paris Shelby. They do not support the use of masks and are very upset with this decision. Auburn Shelby phoned to say she does not support this decision and will not be wearing a mask. It violates constitutional rights. An anonymous called. I am from Waco and my whole family is from Waco, and I don't like to see where someone's forcing someone to do something. It's called extortion and receiving information from one source versus from multiple experts. There should be fair civil discourse between experts before taking action. And the final phone-in call from anonymous is concerning the order for face mask and an expression that they do not live in a communist nation and would not like to be told how to live. Finally, I would like to read from the McLennan County Medical Society. Whereas COVID-19 can lead to serious illness and death, particularly in vulnerable populations, and whereas transmission of the SARS-CoV-2, which can lead to COVID-19, remains a significant threat to the health and safety of McLennan County residents. And whereas SARS-CoV-2 can be transmitted by individuals without symptoms, and whereas the transmission of SARS-CoV-2 has not declined, but rates of incidence and prevalence are instead continuing to increase, and whereas evidence suggests that wearing a face covering can limit an infected person's transmission of the virus to others, and whereas the United States Center for Disease Control, CDC, recommends wearing face coverings in public settings where other social distancing measures are difficult to maintain, for example, grocery stores and pharmacies, and whereas the American College of Occupational and Environmental Medicine, the ACOEM, encourages the use of face coverings in workplaces dealing with the public, be it resolved that the Board of Directors of the McLennan County Medical Society recommends that businesses in McLennan County that engage the public, grocery stores, hardware stores, clothing stores, etc., require employees, customers, and other adults on their premises to wear face coverings over their nose and mouth at all times when in proximity within 6 feet of other individuals, including co-workers, is expected or likely. This recommendation does also apply to age-appropriate face coverings in children per CDC guidelines. Face coverings may include homemade masks, scarves, bandanas, or handkerchiefs. The McLennan County Medical Society, the MCMS, also recommends that N95 respirators be conserved for use by healthcare providers and first responders unless by the recommendation of a physician per CDC guidelines. MCMS also emphasizes that face coverings are not a replacement for physical or social distancing, frequent hand sanitizing, self-isolation when sick, or quarantine with close contact to a confirmed case of SARS-CoV-2. Signed this 22nd day of June, 2020, William T. McCunniff, MD, President, McLennan County Medical Society. And those are all the comments that we received.
Thank you.
Thank you, Liz. And thanks for reading those in. Thanks to each of our citizens who submitted comments. And I want to thank the McLennan County Medical Society for their resolution in favor of this. We have one work session item. It is work session 2020-424. Wiley, will you please introduce this item?
I guess good morning to you and council members. This is a discussion of coronavirus disease 2019, including an update and recommending measures to reduce the spread. We have Dr. Brenda Gray, our Waco McLennan County Health District Director with us, and Dr. Farley Verner, who is the local health authority, to lead this discussion. Doctors?
Good morning. Oops.
Good morning.
So can everyone hear me with the mask on? Or do I need to get a little closer to
Yes.
the microphone? Okay,
We can hear you.
good, thank you. So as of June 22nd, we had 17 new cases, which brings us to a total of 371 cases. This is still slide one. Thank you. So this is just a general summary of where we are as of yesterday. 145 cases recovered. We have 5 deaths, 11 hospitalized, 11 are critical, and 9 are McLennan County residents. We are currently actively monitoring 458 cases. The age group for those cases, for the 17 that we reported positive on this 22nd, were 5 cases were between 20 and 29 years old, 8 cases between 30 and 39, 2 cases between 40 and 49, 1 case between 50 and 59, and 1 case between 60 and 69. Slide 2, please. So this slide shows our active cases.
Hey, Dr. Gray,
Yes.
Dr. Gray, I'm so sorry to interrupt you. You said something that I've been receiving questions about.
Okay.
And so just wanted to, if you could please clarify why we're reporting those that are in critical condition that aren't McLennan County residents. If you just want to give a little bit of background, because I know I've received some questions about that. If you wouldn't mind, thank you.
No problem. So the reason they're counted in that number because they're in our hospital system using our resources.
Perfect. That was exactly what I was looking for. Thank you so much.
Thank you. So back to slide 2. So as you can see, from 6/8 to 6/22, we've seen a significant increase over the past 2 weeks. We've gone from 12 active cases to 220 active cases. Slide 3. That indicates a 1,600% increase in our cases. And what I want to do is emphasize a little bit on this snapshot here. So from 6/8 to 6/20, we had 52% of those cases reported being Hispanic. 85% of those cases were under 60. And remember, the timeline is 6/8 to 6/20. We're not counting this week because we don't have complete data on that. So 24% of those are 20 to 29. 63% are Waco residents, and 12% are McGregor residents, and 50% did not report comorbidities, and 13.2% report they were asymptomatic. Next slide. So in this slide, I want to also have a caveat here, is that the testing from Sanderson Farm, which there were about 1,098 tests, are not included in this data. We're still waiting back. There's a number of pending tests, so that's why it doesn't include it. But you'll note from 6/2 to 6/9, there was a significant increase in testing, and that's where the spike in the curve is, because we did long-term testing. The governor's order mandated that we do all the nursing home facilities. We had 15 in our area that we had to test. 5 of those determined to do tests internal on their own without support of the public health district. 9 of those we facilitated testing We had approximately 1,700 tests done. There were 3 positives, 2 were at Roar Manor, and 1 was at Senior Care of Hewitt. As I stated, the Sanderson Farm testing is not complete. That was done with the Texas Military Department. There were approximately 10,098 tests done, and 5 of those were positive from McLennan County. Five were positive, and 4 were McLennan County residents. We facilitated and actually did testing at 1 business. At Chewy's, there were 2 tested positive before we did testing of the entire facility, and after that testing, there were no more positives in that particular facility. Next slide, please. So this slide shows the 7-day running average of positivity rate from 317 to 220. So you'll note at 324, where there was close to a 9% positivity rate, across that time where the orders from the governor and the mayor were enacted, we saw that flattening of the curve, and then we also see an increase at 616, where we are at a positivity rate of about 8.7. Slide number 6, please. So the next slide is our hospitalization rate, and you can certainly see how how the rate corresponds with the reopening. Prior to the reopening, we had approximately 3.25 hospitalization rate. You can see the kind of flattening of the curve over time. In the reopening phase, we see a number of spikes there. The second opening, there's another spike there, and then at the third spike, which was 6.3, we see a significant increase in our hospitalization rate, which is almost at 4.5 at this time. Slide number 7. So the rolling average daily count rate, prior to the openings, we were averaging 2 to 3 cases per day, and now we're averaging 30 cases per day. So Dr. Berner is going to talk a little bit about the value of masks and face coverings, but before we talk about that, I'd like to share a little bit. There's a slide in there, the next slide, that emphasizes some of the quotes that we received. The first one is the governor of Texas. He says, to state the obvious, COVID-19 is now spreading at an unacceptable rate in Texas, and it must be corralled. And wearing masks will help us keep Texas safe. So the governor is endorsing us wearing masks. A Speaker of the House, he said it's time to mask up, providing more support for us instituting our order. And then the Texas Medical Association says the governor told us all what we need to do. We need to wear a mask, Texas. So I'll turn it over to Dr. Berner to talk about the academic and the peer-reviewed and probably some of his personal and expertise perspectives on mask wearing.
Thank you. Just to be clear, what we're talking about in the discussion, we keep using the word mask. We're not referring to N95 respirators. We're not referring to the surgical masks, which are a different makeup and quality, 2 to 4 layers of polypropylene fabric, as opposed to the disposable masks, which many are wearing currently, and other cloth masks, cloth face coverings of the homemade variety. That's what we're discussing here in the mandatory mask use. The use of surgical mask or N95 mask in those settings is not recommended. And needs to be noted that in the directive, there are exceptions for medical conditions so that those who have difficulties are not required to wear their mask. And we'll come to that one later on. In general, all the efforts that we do to affect the COVID-19 epidemic, we have no one effort that we're doing, from whether it's social distancing or masks or shelter in place. No one effort alone obviously is going to stop it. All we can do in this setting is identify those measures that will reduce the chance that someone with virus is going to transmit it to another person. And the wearing of masks is one of those efforts. This virus is spread from person to person in droplets and aerosols that contain virus. We are like human atomizers. Definitely when you cough or sneeze, it's obvious that aerosols and droplets are generated, but it's also occurring simply with talking and even more with singing or yelling or cheering. The masks themselves you can think of as serving two purposes. One, they can act as a filter to trap these droplets and aerosols so that provides some protection for the wearer. It also prevents touching the nose or mouth in between frequent hand sanitization. And cloth masks, face coverings are clearly less efficient filters than the surgical mask or the N95 mask. They are not perfect by any means, but they do make a difference. Secondly, masks act as what we call source control. A cloth mask definitely does not eliminate, but reduces viral shedding and droplets and aerosols that are generated by the wearer of the mask. This is actually the major benefit of wearing a mask in this situation. The person with COVID-19 has the greatest number of virus in their respiratory secretions at the time their symptoms are onset. And for the 2 days prior to that, when they don't have any symptoms, the number of virus is building up to that peak. But the point being that during those days prior to onset of symptoms, a person who's going to develop COVID-19 symptoms is contagious. Those that have such a mild illness that they may never know it, but could test positive, also have virus in their respiratory secretions and therefore in their aerosols and droplets that they generate. It turns out that it may be 50% or so of people who acquire COVID-19 infection get it from someone who is not symptomatic at the time of their exposure, whether they're pre-symptomatic or asymptomatic. They don't know that they have it. And this is the point, the reason why everyone should wear a mask, because it's those times, that time period where you do not know that you have acquired the infection, but are transmitting virus, that the benefit of wearing a mask has its major effect. And talk of some of the indications that masks are a benefit early in the epidemic when masking was less used, and in times when PPE wasn't available, it was still noted that the contacts of patients, or correct, contacts of people who had infection became infected less often if the person with COVID-19 was wearing a mask. An example of source control. When you look at investigations of clusters of cases where a number of cases were identified as coming from a single event or point source, 3/4 of those clusters were generated from events where people did not wear masks, as opposed to the 1/4 that were identified as being from an event where people did wear masks. Another example where wearing the masks does not prevent infection, but it definitely reduces the likelihood. The recently released Texas A&M study that came out and was published or shown recently, what they did was analyze the epidemic trends from the Wuhan, China, the Italy, and New York City, looking at the epidemic curve and comparing those. In China, the social distancing, the shelter in place, and the mandated mask wearing all occurred at the same time. And then they could contrast that with Italy and New York City, where the mitigation efforts that were used initially did not include mandated mask wearing, and then look at the epidemic trend that followed the initiation of mandated mask wearing in New York City and Italy, and found that a major determinant of that epidemic trend, that improvement, was the mandated use of masks. Not that it was among other determinants, the mandated use of masks was felt to be the major determinant of improvement. That during a 3-week period in New York City, after mandated mask use, that the estimated number of infections that were prevented was 66,000, and that the daily rate fell 3% per day during that time in New York City, as opposed to the United States rate in areas without mandated masks, where the rate continued to increase at 0.3%. You can show the next slide. Mask use is more effective the more people that wear it. What is shown here, if you just look at the top left graph, that is an epidemic curve model that is using cloth mask type mask efficacy, which is probably 25 to 50%. And the tall, steep point of the curve is where mask use is, where there is no mask use. And that each curve that gets lower and lower is with increased coverage with masks, from 10% for the taller red one down to 75%, so that if the population, if 75% of the population uses masks, you get a much greater effect on the epidemic curve. It's clear that for an individual person, wearing a mask is not going to eliminate your risk of acquiring COVID-19, and it doesn't eliminate the risk that you might transmit it to someone else, but it does in fact reduce those risks. So we're looking at a population benefit that is cumulative, and rather than a single person's view that it's either is or isn't going to protect them, that with a large portion of the population using masks, we can have a significant reduction in the number of cases. And just as in what we see as the restrictions for travel and restrictions for shelter in place and the reopening of businesses, that voluntary compliance isn't really getting us there. The same is true with wearing masks. I don't believe we're going to get there if this is voluntary. I strongly recommend the addition of face coverings as being a mandatory effort in controlling the COVID-19 epidemic locally, and would be true nationally as well.
Okay, is that the end of your prepared remarks?
Yes.
Dr. Werner? Well, thank you both for your excellent presentations. I want to open this up for questions and comments by council, but first I'd kind of like to set the stage on why I felt I needed to pass that order on Friday. We were seeing this really rapid run up in cases, as Dr. Gray said, 1,600% over 2 weeks. And to me, more importantly, was the increase in the positivity rate, which was going up a whole percentage point per day, almost every day last week. We were several weeks ago below 0.5% in positivity rate, and now we are somewhere between 8 and 10%. That's very concerning, because that positivity rate is, as you all know, the total positive tests divided by the total number of tests. And so when you see that going up, it means not only are we doing more testing, that is providing some of the additional positive results, but we're having a much greater percentage of those tests come back positive. So that indicates that there is more prevalence of the virus in our community, and that's the big concern. The other thing that happened last week was that early on, when the governor took control of the reopening, he made clear in his orders that neither cities nor counties could do anything any more strict or any more lenient with their orders or they wouldn't be valid. Then in the middle of the week last week, he made a statement that an order that Bexar County had put in place requiring businesses to mandate face masks for their employees and their customers was permissible under his orders. So those two things combined caused me to think we needed to do that. And it is, as Dr. Werner said, it's the Texas A&M study came out last week also, which said that wearing a mask is likely the most important measure that we can take to try to prevent the spread. So, and it's because of the pre-symptomatic and asymptomatic persons that Dr. Werner just mentioned. And the main benefit of the masks is obviously to protect those around you, not yourselves. And so many of the emails that I've gotten against this are asking to have the freedom to choose. Well, if you choose not to, you're not hurting yourself, you're hurting those around you. So with the cases rising as rapidly as they were, and I did consult with all of you before passing that order, I felt the time was critical. I mean, that's the way this pandemic works. If you're going to take a measure, you need to act quickly rather than waiting to act for that. So that's why I did it. I don't like initiating these orders. I'd prefer to do it in a council meeting, but in order to protect the health and safety of our community, I felt it was necessary to go ahead and do that on Friday evening. So I'll open it up now for questions or comments by any of the council members.
Mayor, this is Holmes. Should I make my comments in the context of the resolution, or just in the context of this work session item, or are we combining all this, or
I think it's appropriate to ask questions of Dr. Werner and Dr. Gray at this point, and then other comments
Wait.
we can probably save for the action on the resolution.
Got it. I have no questions.
I do have some questions. One of the things you mentioned was the positivity rate, and Mayor, you just referenced that, and you said that's between 8 and 10% today, but early last week it was around 0.5%. Did I hear that right?
I believe it was a little bit farther back than that when it was that low. It was maybe 2 or 3 weeks ago. Dr. Gray, do you have that information handy?
Yeah, I do. Let me pull up the slide. So very early on, 317, Councilman Meeks, we were right at 7.5. And at 324, we reached our highest peak before the reopening, almost 9%. And then we saw it drop between 331 through 319. And then 326, we saw it increase to about 3%. Then we saw the significant increase starting around 616, which we are close to about 8.7%. And we don't have all the data. This goes to 619. We are 2 or 3 days behind that, but with our cases increasing, it's likely that it's close, as the mayor said, somewhere between 8.7 and 10%.
What is the positivity rate that we should be most concerned with? I know that the governor mentioned at one point that if positivity hits the 10% mark, we should be, I think he used the word alarmed. I could be wrong about that. But what is there, something to monitor with regard to the positivity rate?
It's an indicator of two things, actually. If you think of, in general, why tests are being done, someone presents with symptoms, a situation that prompts a test by their physician. And if your positivity rate is only, say, 4%, then you have a large number of people who have symptoms and they don't have COVID-19. And then you have a time period where there's more COVID-19 in the community. If you're doing the same number of tests, then and the other illnesses are not increasing, then it's your positivity rate reflects increased activity that's going on, and that's what we're monitoring there. As far as a particular cutoff point of alarm, certainly if you get up around 10%, you become more alarmed, but we are already at a point where we can see from that rate that significant numbers are occurring and can be expected to continue. It's our impetus to step up efforts that we have available, and wearing masks would certainly be one of those.
The next question I had was, and this might be a question for staff as well, but at what point do we, or council maybe, at what point or what are we looking at from a positivity rate to roll back this order? When do we plan to amend this order to not require masks?
Dylan, I think that's a really good question, and I don't think we know the answer to that yet. I think it's going to depend on what's happening around the state, in addition to what's happening in McLennan County. And so there are a number of factors I think we'll have to take into account, and we'll have to hear from our health authority and continue this dialogue, because we're in this for a long time in this pandemic. We're talking about at least several more months. So I just think we're going to have to monitor it as we go along. Would be my opinion about that.
And this order, how long is this order for? 2 weeks?
I believe it is. Judith, can you answer that?
The order is until July 7th.
Okay.
Currently.
Right. Thank you.
Okay.
It's
And then the next question I had is, Dr. Werner, where did the study, or Dr. Gray, where did that study that had the slide with the graphs on it, what study was that from? I think it was the last slide in the presentation. Was that from a published study?
Yes, I can get that. I have that reference here. I can get to you.
That would be great. Another time is fine, but I think, in fact, I would just say if there's any other studies that you find compelling that you could share with us, I think that would be helpful. Another question I've had is, I've read that 2 parties wearing a mask is more effective than 1 party wearing a mask and 1 party not wearing a mask. And I wanted to see if you could speak into the, are there any studies that show that, or is there any evidence that you've seen that indicate that 2 parties wearing a mask versus just 1 party wearing a mask creates a level of effectiveness that's greater?
So that comes from the fact that if you have 2 people wearing a mask and one of them has COVID-19, then the mask is acting as source control from the person who's infected, and it's acting as a filter for the person who's facing the person infected. And that effectiveness is much less for the person who does not have it than it is as a means of source control from the infected person. So if only the patients in the hospital with COVID-19 wore masks, we'd definitely have increased transmission to healthcare workers. And in the hospital, we encourage the patients to wear masks when healthcare workers are in the room. And that's trying to cut down on the source in that setting. But outside of the hospital, where cloth and regular masks are being worn, you have less effect, but again, it's the sum of all of those effects together that provides that level of benefit that makes it useful, but clearly not 100% effective.
Another thing I've heard is that a lot of these studies are from places like New York City, which is different than Waco, and our way of life is different in Waco. Could you speak to the relevance of studies that are done in different parts of the country, or even in different countries, and whether or not that data translates to Waco as a Waco doctor?
It's certainly true that in many other places, the density of the population is much higher. And it may be that in those situations, people interact more frequently. And the effect of masking may be greater in a more dense population. I don't know that there are studies that address that would apply locally. I think it's clear from the number of new cases that we're having now that we're having enough interactions between people to drive a steep rise in cases. And if masking is going to have some benefit, then as opposed to the more onerous restrictions that we don't want to go back to. The use of masks is cheap, and it's probably the least intrusive of the things that we're proposing to limit spread. I think I would expect that over time, as we learn more about the benefit from it, that wearing masks may be one of the last things that we release, as opposed to being one of the things that we stop doing early.
Okay. I've heard from people that we need to just establish herd immunity. What is, do you have any comments on that? Why are we, in other words, people have just said, we're going to get it. Let's go ahead and get it over with. Let's just get it. As a medical professional, do you have any commentary on the herd immunity theory that I've heard stated?
So herd immunity occurs when enough people have had the infection and are immune that the likelihood that a person who has the infection is going to run into someone who's susceptible drops off, and the number of people that a infected person turns around and infects becomes less and less, and that slows down and eventually stops the epidemic. To get herd immunity, you have to have the majority of the population have been infected. Right now, we're under 1%. To achieve herd immunity, you're talking about having instead of 300, 400, 500 cases in the county, you need 125,000. And with 125,000 cases, you have at a mortality rate of 5%, you're talking about 6,000 people. So waiting for herd immunity is not recommended, let's say. So
thank you, Dr. Verner.
To me, the goal would be that, yeah, we flatten the curve, but if we can keep the number of infections down relatively low for a long period of time, then we expect and certainly hope that with vaccination becoming available at some point, then you can achieve herd immunity because you've vaccinated.
Thank you, Dr. Verner. Many say that this is similar to the flu, and we don't take drastic measures like this with the flu. Can you distinguish between the flu and COVID-19?
I'd say one of the major differences is in the mortality rate. Just looking at that itself, the mortality rate is much higher, and we've had 2 going on 3 times the number of deaths in the United States thus far in the epidemic than we have as what is reported as influenza-related deaths each year. People that are dying with COVID-19 are dying more frequently of actual COVID-19 pneumonia, and death from influenza is often precipitated, their illness precipitates a more serious disease, a serious infection because of other comorbidities. But that to me is the major difference between the two.
Thank you, Dr. Werner. The last question I have is Waco hospital beds and ventilators. Are we at a place where our numbers where we are now and the rate of acceleration alarming from that perspective?
Both hospitals are monitoring that very closely, and they are not stressed at this point. And right now, I'd say it's going to be dependent on how far that curve climbs over time, but we certainly have room in the capacity for more cases. We just hope not to get them.
Thank you, Dr. Werner. My next question is for staff, and it goes to the enforcement of this. There's been a lot of confusion in the community over whether or not this would be enforced by the police department or code enforcement. Can someone speak into how this will be enforced?
We're going to have Ryan Holt step up for a moment and discuss that. Ryan, why don't you come over here and sit in my slot?
Certainly, Council and Mayor. So the enforcement of this particular portion of the declaration will be just like our previous ones. It'll be based on complaints only. Our enforcement team will go out to those complaints, and then if businesses have trouble with folks who are not abiding by the order, then they can call the police for assistance with that. But the primary enforcement will be from our enforcement team, and will be based on complaints only.
That's code enforcement, right?
Yes, code enforcement.
Code
Sorry.
enforcement.
Yes.
Dylan,
Sorry.
you muted.
Yep, sorry. Another question I've heard in the community is if customers come in and they don't want to wear their mask and they get confrontational, what responsibility will be on the businesses to require their removal? And there's been concern over that. Can you speak into that from an enforcement perspective?
Certainly. We've discussed among staff and with some business folks that have already inquired. We're looking for compliance from the businesses to fulfill the obligation under the current declaration. And if a person refuses to wear a mask when they enter the business, then we certainly don't want folks to get into an argument or create conflict there. But the business owners in a private property state have the right to require customers to do certain things. And in this particular case, in talking about wearing a mask, that is certainly the right of the business owner to require them to wear the mask. And so they can always call the police department for assistance in enforcing, in that case, what would be considered criminal trespass. If the officers come out, the officers will certainly attempt to seek voluntary compliance, either by asking the individual to leave upon request of the business owner or manager. And if they don't leave, then enforcement action can be taken. We'll certainly start with the lowest and escalate those as required by the individuals refusing to cooperate with the business owners.
The last question I have is for those individuals who might have a health reason for being unable to wear a mask. Can you speak to that?
There is an exception in this declaration for folks that have various medical conditions. And so, that'll need to be a conversation with the business owners and the individual with the with the issue, that they are recognizing that particular exception as to why they're not wearing a mask. And then there are also other opportunities for conversation with the business owner and their customers about how they would implement that exception.
I think that needs to be clarified. We don't have to do it in this moment, but at some point, and if not now, I don't know when, but we need to clarify that, because I think there's a lot of confusion for businesses on how they police exceptions. And when people say they have an exception, what they're required to do to avoid a fine. So there is I think we need to play out these scenarios carefully, because I think that there is going to be some confusion with different business owners on what the risk they're encountering in not policing customers who are refusing to wear a mask. In other words, if someone says they have a medical condition that prohibits them from wearing a mask, does that mean the business then is exempt from a fine if someone else reports a code violation there? So I think that's fair to the business community to have clarity to those issues.
Dylan, I agree with you on that. I think that's one of the most challenging things we're going to have to deal with. And just like we did in the prior orders during shutdown about what were essential businesses and non-essential businesses, we're just going to have to work through this over time. I mean, we've never been through this before. These businesses haven't been through it. But we are talking to the other counties that have implemented this ahead of us, and so we're hoping that we'll maybe get a little bit of early information about how they've dealt with things and be able to apply that knowledge as we're going forward.
Strategically communicating it to the business community is going to be critical. So I do think that we did a great job with COVID. We need to do it again and pull in all of our business partners, our chambers, and other partners to make sure that this information is being distributed and disseminated well.
Agreed. Other questions or comments for Dr. Werner and Dr. Gray?
Yes, sir, I do. Dr. Werner, thank you so much for the presentation. Dr. Gray, I have a question about, can we go back to the testing slide, if you don't mind, please? I'd like to look at some of those testing numbers and the number of tests that are being done in our county specifically. It's a few slides back.
I think, no, this one here.
It has the orange graph, I believe.
One more, number 3.
Oh, you were showing
Number
us. I didn't
4,
know you were
number
showing
4,
me.
number 4,
Thank you.
number 4.
Okay. So I'm looking at, so for the most part, all the way until 6/2, we've had a little increase in testing, but we have really seen an increase the week of 6/9, I should say. Dr. Gray, would you attribute more tests being positive because we're doing more testing, or would it be vice versa? The reason we are seeing more positive tests, so therefore we're testing more. How would you say the rationale behind that would be?
I think we're seeing more. One of the things that we assumed from the beginning is that you do more testing, you're going to find more cases, and so but we also have more positive cases that's being revealed by the testing. So it's kind of like which came first, the chicken or the egg. So
right,
yeah.
Are those? I'm not sure. Do those testing numbers include the nursing home?
They do. They only include the nursing home, not the Centers Farm. So just
Right.
that big peak between 6/2 and 6/9 includes our nursing home testing, and that was about 1,700 tests.
We had a large number of tests done in the nursing homes, and and a small number of positives during that time.
Sure. And Dr. Werner, I'm glad you said that even though we, according to the governor's orders, we had to do our testing in the nursing homes, but we're not seeing the positives there in the nursing homes or even with the elderly community. I believe, Dr. Gray, you said it's 60 and under. And so that's where we're seeing a lot of our positives. And that's the part that's concerning to me. I know that, I can only speak for our city and our county. Yes, we're doing a little bit, we are doing more testing, but not to the point where we should see our positive cases increasing the way they have been. And I think that's the concerning part for me, is that even though in spite of the testing that has been pretty much kept steady, we're still seeing more and more increases. And so that's alarming to me. But the other question that I had, Dr. Gray, is I don't know if even, or you or Dr. Werner could answer this, and I don't even know if it's possible, but if we were to make the mask mandatory, what is there a timeline, or in your expert opinion, the time that it would take to get our test numbers down? What's that time frame look like, and how much do we feel comfortable? Like, is it 10 or less positive tests a day where we feel comfortable saying, okay, we don't need the mask order anymore? I mean, I guess I'm trying to seek your medical expertise on that.
So, right now, we look at the number of new tests per day as an indicator of what just happened. It takes, if you make a change in, such as initiation of mask use, if you make any kind of change that actually affects the number of cases that are out there, whether it's changing it for the worse because you have more interactions, or changing it for the better because you've instituted something that's effective, the appearance of that effect in the number of new cases per day has got to take at least a week, probably 2 to 3 week range before you see the difference. If you do something on Monday and over that next week you have fewer cases transmitted, then it's not until 4 to 10 days later, when those people who got an infection become symptomatic, and then it's a day or two later, depending on how soon they seek care, that they get their test done, and it's the day or two later before you get test results. So you're looking at a minimum of probably 2 weeks before you could start to see a difference, and it's probably even longer than that the growth or the decrease in the curve really becomes manifest in a useful way.
And then the other part of that question, and I'll be quiet after this, is in your medical opinion, what would be the good number of tests per day? Is it 10 or less, 5 or less, where we can say, okay, maybe we can lift the mask order? And if you don't want to answer that, because I know it's a tough question, I completely understand, but just in your medical opinion, what would you suggest?
By number of tests per day, I'm not sure
I'm sorry, a number of positives per day. I
number of new
apologize.
cases per day.
Yes,
Yeah.
sir.
No, there isn't a particular cutoff.
Okay.
There's, because the reduced number of cases that happen is still going to be a combination of all the efforts that are being put in place, and it's hard to tease out
Sure.
the effect of one, but I go back to the point again that releasing, opening up, doing more activities versus mask use. The mask use is the least intrusive of all of those.
Thank you so much, sir. Thank you, Dr. Gray and Dr. Werner, again, for the presentation. It was very helpful information. Thank you.
Are there any other questions for Dr. Werner and Dr. Gray?
Very quickly, thank you both for your comments and your presentation. Dr. Gray, could you repeat the number? You were offering percentages of our, within the 1,600% increase. Would you repeat the number of asymptomatic
13.2%.
cases? Thank you. And to speak to Councilmember Meek, about the communicating with our business community. I'm ever sure that between the strategic communication task force and the business and financial institution task force that the mayor so thoughtfully put together, we can make sure that that information is disseminated to our chambers of commerce and our financial institutions that could in turn share that with their business customers. And we can make, I mean, you know, as much information that goes out publicly will continue to go out, but we have specific um, groups of people who are tasked with that. So I'm I know the importance of making sure, and I agree the importance of making sure that our businesses have all of the information that they need to, you know, prepare them for this shift. And but I'm glad to know that, you know, Councilmember Holmes and Councilmember Sabito are at the helm of those task force that can make sure that information gets disseminated properly.
Mayor Pro Tem Bearfield, I agree with that completely. And also, we need to have the information flowing back to council from those businesses through that same setup. And we will, you know, we want to work with our businesses to get through this together. Any other questions or comments for the presenters? Okay, Dr. Gray and Dr. Werner, thank you very much for this, for taking the time to put this together and to meet with us this morning. I know you're both extremely busy right now, especially with high number of cases. So thank you for your time here today.
Thank you.
We will now turn our attention to Resolution 2020-345, which is to consider a resolution consenting to the continuation of the declaration of local disaster and public health emergency issued on March 17, 2020 and amended on March 19, 2020 and March 23, 2020 by Mayor Kyle Deaver, and as ordered by the City Council of the City of Waco, Texas on March 24, 2020, and as extended and or modified on March 31st, April 14th, April 21st, April 28th, May 7th, May 19th, 2020, and May 28, 2020, the city order, and consenting to the continuation of the June 19, 2020 order by Mayor Kyle Deaver, supplementing resolution number 2020-345, all as may be amended and or supplemented by the City Council of the City of Waco, Texas, and modifying the city order in compliance with the orders of Texas Governor Greg Abbott for a phased reopening of businesses. Is there a motion on that resolution?
I'll move approval. I'll second.
We have a motion and a second. I'll ask for discussion and just remind council that we're trying to finish this meeting by 1 o'clock so we can start our interviews. If we're not able to end by then, we'll recess and reconvene. But I do not want to cut off discussion. So let me open it up for any discussion.
This is Holmes. I'll make my comments quick. You know, my experiences as a businessman, I've sat on the board of several, a couple dozen different small businesses, oil field housing, railroads, coal mines, all over the place. So I stand with small businessmen on this deal. And I know the challenges of running a small businesses, you know, product, people, good times where you're managing profits and expanding the business, and bad times where you're having to close down offices and lay off people. And the former is definitely much more fun than the latter. I guarantee you that. The last thing I want to do here is put another challenge at our small businessmen. So all that said, in the context of this pandemic and making sure we don't outstrip and overrun our healthcare resources, I like how the governor and the council and the mayor have been thoughtful and worked together on staging the reopening of the business after our initial experience with COVID. And going from 0 to 25 to 50 to 75 to 100 has been, you know, it's been exhilarating to see us come back. So, and it's, but as the governor has stated, it's all about, you know, data and doctors. And right now, you know, the data's not looking good. I think everybody should understand that. And I'm all about the data. And as Dr. Gray said, on this particular slide, which is so compelling to me, because back in this area here where we thought we'd hit the curve and we were done, or we were being very optimistic, to where this thing is spiked up like crazy, not only from a active case perspective, but also from a positivity rate, where we're hovering up around 10% now. The numbers, you know, don't lie there. what we know about COVID, there's been some good studies out there. A&M, CDC, they're all over the place. The good studies are all over as far as the benefits or what we can do to suppress this. What's kind of different about COVID versus the other flus that we've had, the mortality rate, as Dr. Berner said, it's highly contagious, it's unpredictable, it's mutating, it's unknown, and most importantly, there's no vaccine out there for this thing. And as my brother, who was a U.S. Marine, said, at some points you make a situational assessment and a tactical adjustment. So I think the situational assessment for me here is trends are going in the wrong direction. And the tactical adjustment for this community is to look at what are best practices. And Dr. Berner also said source control, which, I don't want to wear face coverings, but that source control, I'm at least preventing my potential contagion from spreading to other people. Face covering, social distancing, which we've been doing. The safety of the customers and the employees here in the Waco community is what the charge of this council is to protect. So just to close up my comments, it's not easy. I'm a small businessman by nature. I've been doing it all my life, and I hear, and it's in my heart what I'm hearing from the small businessmen in Waco on both sides of the issue. You've got my respect, my admiration. Small business is the backbone of this city, and I appreciate all the feedback I'm getting on this issue, and I hope that I continue to get. And I'm looking forward to getting to the other side of this whole thing. But that is very compelling. The last thing I want to do is to go backwards in the governor's plan of reopening. For us to make this adjustment right now and this tweak, I think is important. I'm supporting this order. Encouraging everybody to mask up. I think that should be the order of the day. Mask up. That said, this is a 2-week deal. I'd like to continue the discussion with the business community, as I will, as Mayor Pro Tem Bearfield said, through my business recovery task force. And I want to continue. Let's tweak it as necessary. If necessary, in a couple of weeks, we'll look at it again. And basically, at the end of the day, let's pray. Let's all pray that we get through this, as quickly as possible. Those are my comments, Mayor.
I'll go quick because I know we're almost to 1 o'clock now. I don't have much to add to that. I just think that whenever we have local doctors and as so many commented, and then Dr. McCunniff from the Medical Society and Dr. Werner are advising us that this is best practice. This council has to take that seriously and has an obligation and a duty to take that seriously. And so I think everyone on this council would say that we don't want to infringe on anyone's liberty or rights, but at the same time, we have an obligation to listen to our medical community and take their recommendations and requests seriously. And then when you couple that with the governor yesterday saying that we can expect additional restrictions statewide if this isn't curbed, it's imperative for us to examine what are the least restrictive means by which we can ensure that we have the liberty to do business and the liberty to stay open. And so it's in that spirit that I think that this is the right call. We are trying to do everything we can to make sure that this economy stays open. And I think given the answers that Dr. Werner gave us a few minutes ago, it's imperative that we take this seriously, that we continue to reevaluate it, and that we continue to communicate with our business community. The last thing I'll say is go support Waco businesses. I know wearing a mask is inconvenient. I'm sorry. And if you have a true medical exception, then everyone will understand that. But despite that inconvenience, wear a mask and go support a business. They're not the ones to be punished if you're frustrated over this situation. So support our Waco economy and know that this is an effort to make sure that our economy does stay open.
I'll also just add quickly, I want to let everyone know that this is not an easy decision that we have to make as a council. And this is not, for lack of better words, a political ploy. There's not a political agenda behind it. It really is for the safety, in my opinion, for the safety of the community. And so, I know that most of Waco does not want to do another shelter in place. We're still feeling the impact of the last shelter in place. And we're hoping that through this order of wearing the mask that we could contain and really slow down the spread of COVID-19. You know, as my fellow council members, my previous council members have said, you know, many of us are, if not all of us, pro-local business, and many of us are local business owners as well. So we understand the frustration, but we also understand the severity of the spread, and we understand that the data is there, that it does not lie, that we have definitely over the last 7-8 days have seen a 16, well, I think the graph said it over since the beginning, a 1,600% increase in the number of positive cases. And so I know it's inconvenient, but please, know that we are doing this really for the safety of our community, for the safety of our people, and to protect those that are more susceptible to this, you know, our elderly community, our babies in the community, the expecting mothers in our community. And so I hope that you would join this. I hope that you will still continue to support your local businesses. As Councilmember Meek said, it is not their fault. Please do not take it out on them. Please still go support your local businesses, because the local business is the backbone of the community. And I also pray, Councilmember Holmes, that we get through this quickly and rapidly. And my goal is my personal goal is to see Waco thriving once again, like we did in past years. But I also understand that we have to just take these steps to get to that direction. And if it's wearing a mask and me and my family wearing a mask, then we will do it. And so, thank you.
Any other comments from council members? Any further discussion?
One clarification: if you're 6 feet apart from another individual, you don't have to wear a mask. Is that right? If you're able to be in a space that's 6 feet apart, or are you required to wear a mask if you are within 6 feet?
Well, that's up to the business owner to determine. But if they determine it incorrectly, and we start getting complaints that you know, people are in their businesses and not maintaining that 6 foot distance, then we're going to have to send our code enforcement officer to look at that. But
we're requiring, what are we requiring exactly?
So we're requiring that the businesses to put in place a plan that if the plan, if the business can't maintain consistently a 6 foot distance between its customers and its employees, and between employees and each other, then they must require face masks from both customers and employees. Now, there may be some businesses out there that can consistently maintain that distance. I don't know what that would be, but theoretically that's possible. I think the reality is most of them will need to require face masks of their employees and their customers when they come in.
Dylan, are you done? This is Holmes again. One other question on the resolution itself. Just confirming, number 3 says this goes through July 7th, which is 2 weeks, confirming that. And then on number 8, the health and safety policy, are we setting a standard? Do we have examples we can give to businesses on what meets the standard of the policy? I just wanted to clarify that. If staff or if they're saying, yeah, I want to build a policy, but am I meeting the minimum standard? And I think that's kind of here, but.
Jim, staff has been working on that. I don't know whether they have it ready yet or not. Wiley or Bradley, can you speak to that?
Mayor, we'll get an update, but it's our intent to place a template on the website shortly. We'll add that to our strategic communications effort as well once it's up there.
Great. Thanks, Bradley.
Any further discussion? Okay, in that case, all in favor of the resolution of the motion, please signify by raising your hand. Okay, and that motion passes unanimously. There being no further business, we're about to adjourn this meeting, and then we will immediately go into our 1 o'clock meeting. So Esmeralda, how do we need to handle that from a technical standpoint? Do we just need to stay on the line here?
I'm afraid you'll have to log into the meeting because that's the meeting link that the applicants have. So if you'll just exit, then we'll reconvene on that Zoom.
Okay, very good.
Mayor?
Yes.
Is it possible to give 3 to 5 minutes?
Yeah, that's fine. Why don't we, let's plan on starting the next meeting at 1:10. It's 1:05 now.
Thank you.
Thank you. There being no further business, we will adjourn this meeting at 1:10 p.m.